and welcome to the Carnivore Revolution. I'm Serena.
And I'm Jess. Before we get started, be sure to hit that like and subscribe to our channel.
Today we have a special guest, Dr. Ovadia, and we are so excited to have him here today. And we're going to talk about heart health. Dr. Ovadia has a book called Stay Off My Operating Table, and he really does want you to stay off of his operating table. So today we'd like to start with the most obvious question, the question that gets asked the absolute most of all people who have a meat-heavy diet or are carnivores, and that's about cholesterol. Why are we worried about it, and why should we not be scared of it?
Yeah, great to be here with you, Serena and Jess, and that is certainly the question I probably get asked most often as well. So there are a couple of reasons that I would tell people you don't necessarily need to be worried about cholesterol, and understand that, you know, this is a contextual discussion. It is going to depend on your situation. So, you know, to go back, the question is, why did we first start worrying about cholesterol in the first place? And, you know, that really goes back to the 1950s with what we call the diet heart hypothesis. It was, you know, really pushed forward by a scientist by the name of Ancel Keys. And the theory was, it's really a two-part hypothesis. And understand that it is a hypothesis. It has not been proven to be true. But the two parts of that hypothesis are that the types and the amount of fat that we eat in our diet affects our blood cholesterol levels. And our blood cholesterol levels then affect our risk of developing heart disease. And when we really, you know, look at the evidence, both parts of that hypothesis have some holes in them. You know, we have very inconsistent data around both of them. So we fast forward, and because meat contains saturated fat, the concern is that that's going to lead to heart disease. But there, again, you know, there are a couple of problems here. First of all, meat is not as high in saturated fat as everyone, you know, talks about it to be. The general consensus is that, you know, meat is like 100% saturated fat. The reality is that most red meat is about 40 to 50% saturated fat. And there has never been a good scientific study that directly ties red meat consumption to heart disease. So, you know, cholesterol is kind of in the middle of all of that. And we can argue back and forth about what cholesterol means. We can discuss it. And ultimately, what I tell people is cholesterol is part of an overall picture. It needs to be interpreted in the context of your overall health, and specifically your metabolic health. And, you know, we do not have data that would support that having a high blood cholesterol level in the context of being metabolically healthy is problematic. Now, I openly admit we also don't have the data to say it's perfectly safe, but, you know, my inclination is based on, you know, the data I've seen, based on the experience of the patients that I've worked with, that if you are metabolically healthy, you probably do not need to be, concerned if your cholesterol is elevated, but that also doesn't mean you should be ignoring it. You really should be working with a physician who understands this and can help you kind of do the risk benefit calculation there.
So how does someone know if they are metabolically healthy or not?
Yeah, so that's a very important question. And I think that's a basic question that oftentimes doesn't get answered in people's interactions with their physicians. So there are a couple of things you want to look at to determine if you are metabolically healthy. There are 5 basic measures that you should start with. These are your waist circumference. And specifically, if you are a man, you want that to be less than 40 inches. If you're a woman, you want it to be less than 35 inches. You want to look at your blood pressure. You want your blood pressure to be less than 130/85. So both of those numbers need to be less than. And that needs to be without the use of medication. If you are on blood pressure medication, it's an indication that you are not metabolically healthy. And then you want to look at your blood work three numbers that we look at from the blood work. We look at the fasting blood glucose level. We look at the HDL cholesterol level, what you'll always hear called good cholesterol, although, I'm not a big fan of that term. And then you want to look at your triglycerides. So you want your fasting blood glucose level to be less than 100 milligrams per deciliter. Here in the US is the units. Again, without the use of medication. You want your HDL cholesterol level to be over, so you want this higher, you want it to be over 40 milligrams per deciliter if you're a man, you want it to be over 50 milligrams per deciliter if you're a woman. And finally, you want your triglycerides to be less than 150 milligrams per deciliter. Those are the 5 basic measures of metabolic health. You can go to my website, ifixhearts.com. There's a calculator. There's a quiz basically right on the front page. It will march you through those and let you know if you're metabolically healthy or not.
Sorry.
And I was just going to say, ideally, you want all 5 of those numbers to be within the healthy range. Only 12% of the adults in the United States have all 5 measures within the healthy range there.
So people get nervous about the LDL cholesterol and the numbers on that.
Right.
And I know that we have talked about this, but many people don't understand that LDL cholesterol has good and bad cholesterol in it also. And that creates this alarm for people. So what do you recommend? Do you recommend people ask for the pattern A and pattern B broken up when they get their cholesterol checked?
Yeah, so there are a number of advanced lipid measures that we can look at and should be looking at, because the bottom line is LDL cholesterol by itself is a lousy predictor of heart disease risk. It's what doctors focus on. It's what the guidelines are built around, mainly because we have medications that can affect your LDL cholesterol level, but it is a lousy marker of risk by itself. And if that's all your doctor can do, then it might be time to find another doctor. So there are a number of advanced tests you can look at. The pattern, which is basically the size of your LDL particles, is important. Pattern A, meaning that you have larger particles, which is good. Pattern B, meaning you have smaller particles, which is not good. You can also look at things like whether your LDL particles are oxidized. This can actually be measured, but that basically means that they are damaged and they are then likely to be involved in plaque formation. But I really tell people you really want to take a step back from that. And separate from your cholesterol, what you want to figure out is if you are insulin resistant or not. And again, there are a number of ways to measure this. You really got to have a good practitioner that you're working with that understands this. But if you are not insulin resistant, first of all, that usually means that you're going to have pattern A, large particles that are not oxidized. And if you are not insulin resistant, it is, highly likely that your LDL cholesterol number really doesn't matter, is what the data shows us.
And one interesting thing that you said when I interviewed you last week is that what we eat doesn't really affect our blood cholesterol levels. Can you expound more on that?
Yeah, so the first part of that diet heart hypothesis, that if you eat more fat, or specifically if you eat more saturated fat, it's going to raise your LDL cholesterol, is an inconsistent finding, I'll say. In some people it does, and in a lot of people it doesn't. And this extends to low carbohydrate diets. The perception out there is that if you're eating a low carbohydrate diet, a ketogenic diet, which of course includes the carnivore diet, that your cholesterol always goes up. And the reality is it's only about 50% of the time that we see that. Some people it goes up and it's a temporary thing and it comes back down. Many people it really doesn't change all that much, is what I see. And yes, some people it does go up. And, again, that doesn't necessarily mean that there's a problem. that's how your body's responding. And there may be very good ways, very good reasons that your body responds that way. It may simply reflect that you have, if you're using more fat for energy, it's being trafficked through your blood on these LDL particles. And so you're going to see more LDL in your bloodstream. But again, I go back to, if you're not insulin resistant, if you're not doing things that are damaging your blood vessels like smoking, then it may not have any relevance what the level of your LDL cholesterol is. The type of LDL cholesterol that you have, the environment that that LDL cholesterol is in, is more important than the amount of LDL cholesterol that you have. And one thing I want to point out, kind of the flip side of this argument, which is, the kind of mainstream thinking that if you just lower LDL cholesterol, you're going to prevent heart disease. And I see this fail over and over again. If you look at the patients that I end up doing heart surgery on, about half of them have what are considered low or normal LDL cholesterol levels. Some of them are on medications, some of them are not. They just have naturally lower LDL cholesterol levels, and yet they're still ending up on my operating table. So what that tells me is that LDL alone isn't giving us the complete picture. And, as I said, we need to be looking at things like insulin resistance when we're trying to determine your risk of heart disease or prevent you from getting heart disease.
And we hear people talk about getting their LDL cholesterol lower, and people are taking drugs for this, and people don't eat saturated fat so they can get their LDL cholesterol lower. But there are lots of bad effects and side effects that come from that also, right?
Yeah, from both things you mentioned, and we need to acknowledge this. So, medications, every medication has potential side effects. And, specifically when we're looking at the medications that lower LDL cholesterol, the statin medications, there are a couple of things that I start to get concerned about when these medications are taken over the long run. And again, we have incomplete data on this, because realize that, the studies that are done to get medications approved are typically relatively short-term studies. They're 2 to 5 year studies. And we have people who are being started on these medications, now in their teens or in their 20s, and they're going to be on these medications for 50, 60 years. What are the effects of doing so? We really don't have that data. They haven't been around that long. We are starting to get some signals about what may happen with that. We know that they can worsen insulin sensitivity. So statins over the long run can actually make you more prone to developing type 2 diabetes. And we know that type 2 diabetes is a major risk factor for heart disease. So that's a problem. There's concerns about brain health over the long run, and things like Alzheimer's. Again, not a proven link, but there are some concerning signals in the data that we're seeing. The other, thing you mentioned, which is changing your diet with the target of lowering LDL cholesterol, has its own problems. Because how do you do that? You do that with processed foods. This is where things like vegetable and seed oils come in. Vegetable and seed oils, if you change saturated fats in your diet to vegetable and seed oils, you probably will lower your LDL cholesterol level. That's fairly consistent in the data. But what isn't consistent in the data is that a good thing? Because a number of the interventional studies that looked at this, where this was done, they basically substituted vegetable and seed oils for natural fats, natural saturated fats. And when they did that, overall mortality went up, and heart-specific cardiovascular mortality did not change, despite the fact that people's LDL cholesterol levels went down in those studies. So again, a lot of inconsistent data here. And the bottom line, like I said, is LDL cholesterol by itself is a lousy marker of heart disease risk, and targeting LDL cholesterol as your way to prevent heart disease just simply isn't working. We have been using that approach now for 30 years. Statins have been the most widely prescribed class of medications worldwide now for about the past 30 years. And we are not seeing a noticeable impact on the incidence of heart disease.
So it's all well and good that you're telling us this, you're telling your patients this, but what do you implement in your everyday life to make sure that you don't get heart disease?
Well, what I do is I implement a carnivore diet, quite honestly. I avoid processed food. I avoid vegetable and seed oils. I eat a primarily carnivore diet. And I can, I can tell you my personal results thus far is that I'm 48 years old. I have a coronary artery calcium score of 0. I had a 0 3 years ago. I had a 0, a few months ago when I rechecked it again about 3 years later. That is despite the fact that for most of that time, my LDL cholesterol level was somewhere between 2 and 300, depending on when I checked it. I have a family history of heart disease, and so I should, have evidence of heart disease at this point, and yet I don't. And so that tells me that the strategy I'm using is working. Again, does that mean it's the right strategy for you, for everyone out there in the audience? No, it doesn't mean that. But you need to be working with a good physician who understands this. And, I am metabolically healthy. I check all those metrics. I've done all the advanced lipid testing. Everything is where I want it to be on that. So the only, I would say if I went to a traditional doctor, when I have traditional physicians, review my blood work, the only concern is my LDL cholesterol level. And at this point, I'm pretty comfortable, with where that is. And I don't see any reason that I need to be lowering it.
Do they ever tell you a good reason for why you should be concerned for lowering it? Or do doctors just tell you you need it lowered? Is there ever a good reason that they have for telling their patients this?
Well, again, the reason is because, they have been educated that is the primary risk factor for heart disease, and that, it needs to be lowered in everyone. And this is really the problem, that we run into with the data, because when you look at large groups, when you look at large populations like they do in these studies, and, on a large population level, there is some correlation between LDL cholesterol levels and heart disease. But, two things to note: correlation is not causation. And within that population, there's a large distribution. And we need to recognize that there are going to be patients with low LDL cholesterol levels that develop heart disease, like I said. And there are patients with high LDL cholesterol levels who don't develop heart disease. And I think we as physicians need to do a better job of figuring out, why that is and, who that applies to. And ultimately, I think that does come down to insulin resistance. If you are insulin resistant, you are at high risk of heart disease. I don't care what your LDL cholesterol level is. If you are not insulin resistant, you are at low risk of heart disease. And again, I don't think it matters what your LDL cholesterol level is. Now, if you are insulin resistant and your LDL cholesterol level is high, and you're not going to address the insulin resistance, then there very well may be benefit to lowering your LDL cholesterol level. But most of us in this community, in the carnivore community, are addressing the insulin resistance. And like I said, if you're doing something that improves your insulin resistance, but raises your LDL cholesterol level some, I'm going to take that trade-off, because again, the science shows that insulin resistance is a much bigger risk factor for heart disease than a raised LDL cholesterol level is. So even if we believe all the data around LDL cholesterol, I'll take that trade-off ultimately. And that's the type of, thinking, I guess, that we need to bring to this. And hopefully your physician can have conversations like this with you.
So I was talking to my brother a few months ago. He had what people call like a mini heart attack, I guess, maybe 5 years ago, and was in the hospital for a while. And he's home now, and he's following, I believe, the DASH diet, which I know is really popular for stuff like that. And he's still inflamed and having health problems. And it's been a long time. And so I was kind of telling him a little bit about what I'm doing and how great I feel. And he said to me, I'm doing everything they tell me to do. I'm following this plan exactly, and I'm still not healthy. Why would I switch to something you found on the internet? And I said, but isn't that the problem? Is that for the last 5 years, you're doing everything. And he is doing it. I promise he is.
Right.
And I said, isn't that the problem? You're doing everything they told you to do, and you're still unhealthy. What would it hurt to try something else? And then he just kind of changed the subject and went on. So my question for you is, somebody like in his situation, for instance, how do they find a doctor? You mentioned a few minutes ago about finding a doctor that is on board that can help you with this. How do you find a doctor that would be on board with your LDL cholesterol being too high without making you take a medication? How do you find a doctor like that?
Yeah, it can be very challenging because obviously this very much goes against the mainstream thinking. But, your brother is a perfect example of what I see every day as a heart surgeon. For the most part, the patients that come to me have been following their doctor's advice. They've been taking their medications. The honest truth is most doctors don't even discuss diet with them. But if they do, they're following their advice. And yet they're still ending up on my operating table with heart disease, the very thing that we were targeting, that we were trying to prevent. And that's what really has spurred me. I was unhappy with the health results I was getting personally, and I was unhealthy with the results that my patients were getting from the advice that that they were given. We need to change course. We need to start questioning the advice. Someone like your brother needs to start asking those questions. I'm following all your advice. I'm feeling lousy. Most likely if they're assessing his heart disease, they will see that it is progressing. We oftentimes just don't assess it. We just ignore it until, unfortunately, we have more problems with heart disease. So I think that is a very inadequate approach. You want to find a doctor who is more proactive. And it can be challenging. There are resources out there. I typically point people to directories like the Society of Metabolic Health Practitioners. The SMHP is the website. And they have a directory of metabolic health practitioners. Ask your doctors these questions. Am I metabolically healthy? Am I insulin resistant? If they can't answer those questions, if they're not able to have that conversation with you, you need to keep searching. The unfortunate thing is that, you can't be passive about your health. You can't outsource your health to your doctor and assume they're going to make you healthy. You certainly can't outsource your health to, the government or the pharmaceutical industry to make you healthy. You have to be actively managing your health. You have to be in charge of your health. And it may take effort. You have to go online. You have to try and find the doctors. You have to connect with them. You might have to travel. You might have to pay out of pocket. Your insurance may not cover this stuff. But that should be an investment that you're willing to make, because the return is a lifetime of good health, better quality of life, longer life, avoiding these chronic medical problems. And so that should be worth the investment, both in terms of time and money that might take. Over the long run, I believe it actually is a good investment. You get a good return on that investment. You're going to save money over the long run when you don't have the chronic medical conditions, even if you're spending it up front to see, to find these doctors and maybe get some of this advanced testing that may not be covered by insurance. But I think that's a worthwhile investment. that people should be willing to make.
My final question would be, as a heart surgeon, do you think there is ever a time that someone should be taking a statin? Is there ever a reason that you think that that would be okay?
Yeah, like I said, if you are metabolically unhealthy and you have a high LDL cholesterol level and you're not addressing the metabolic health part of it, there's probably a small benefit to taking a statin in that situation. If you already have established heart disease, and again, you're not addressing the metabolic, health, the insulin resistance, there may be a benefit to taking a statin. You get a much better benefit, a much bigger benefit if you address the insulin resistance and the metabolic health. Again, I don't say that statins are never indicated and never beneficial. I just think that they are an incomplete, it's an incomplete approach to just say, we're going to put you on the statin and that's going to take care of your heart disease, because it simply doesn't work.
So, and my final question is kind of the elephant in the room for me for the last few days since it became really public and people started talking about it a lot, is the new person that's been appointed to the U.S. Dietary Committee. And this is already kind of a passion of mine. I feel like we have to change those guidelines. So hearing Fatima Stanford's quotes from her 60 Minutes interview about how obesity is genetic and comparing it to a disease instead of something, that we are doing to ourselves. And I just wonder what you think about that as a heart doctor. How does that make you feel that somebody would say that it's genetic that we're overweight or obese?
Yeah. So, I think genetics play a very small role in this. Yes, genetics may determine sort of a window that we could live in, and more of us, some people may be prone to obesity because of their genetics. But the bottom line is that the habits, the food that we eat, the activity that we get, the sleep, the stress, all these things that go into it are much more powerful determinants of our health outcome than the genetics are going to be. And, I put myself forward as an example of that. My parents are, both obese, and both actually had gastric bypass surgery, and I was obese for most of my life. But now I'm not obese. And so my genetics didn't change. My habits are what changed. And so, no, I do not believe obesity to be genetically determined. I don't believe heart disease to be genetically determined either. Can your genetics make you more prone to the damage that occurs from these habits? Certainly. But the habits are much more powerful determinant of our health than the genetics are. And I think it's a little sad, quite frankly, that doctors, what I oftentimes see is, from the medical, system. And again, I'm not blaming individual doctors for this. I think it's a systemic issue. But the system, does something like says, okay, we're going to, you need to be on a low-fat diet and you need to take your statin and lower your cholesterol, and that's going to prevent you from getting heart disease. And then the person gets heart disease and they say, oh, well, it must have been genetic, instead of saying maybe we gave the wrong advice. And so that's what I see happen over and over again. That can be applied to obesity as well, because what's our advice to people who are obese? Eat less, move more. And when it doesn't work, we just say, oh, well, it must be genetics, instead of questioning, maybe the advice is lousy to start with.
Well, Dr. Ovadia, where can people go to find you and follow you?
Yeah, sure thing. So best place to start is to go to my website, ifixhearts.com. Like I said, you can start with the quiz there that will inform you whether or not you are metabolically healthy. All my resources are available there: the book, the courses, our group and individual coaching programs, and joining my medical practice. I have an online telemedicine practice. I see patients from across the United States for preventative measures and to help them to stay off my operating table. On social media, I'm most active over on Twitter at iFixHearts. You can also find me on Instagram at Ovadia. It's Ovadia_heart_health. But if you just Google my name, it's not a very common name. You'll come across me.
And your book, right? I'll be sure to link all of those links and then put your book below as well.
Perfect.
Well, thank you so much for joining us, and we'll see you next time here on the Carnivore Revolution.
Bye.